As part of the University of Texas Health Science Center here in Houston, our center serves approximately 850 pediatric and adult persons with bleeding and clotting disorders in and around the Houston area. We have a full team of 30 individuals here on staff, 4 physicians, 3 of which are pediatric hematologists and 1 who is an adult hematologist. And we also have several clinical and research nurses, a nurse practitioner, social worker, physical therapist, pharmacist, lab associate, part-time geneticist, and various administrative support staff persons that assist with running our program. These staff members hold clinics maybe 2 or 3 times a week right now, and these type of clinics are comprehensive care visit clinics, follow-up, and new patient visits for our population. Our demographic right now is a breakdown of approximately 35% Hispanic, about 15% African American, about 40% Caucasian, and we have about 10% of our total population that self-identifies with multiple backgrounds. So pretty diverse demographic that we have here in our Houston and surrounding area for our patients. So our patients that come to our center sometimes can come as close as 15 minutes away from where they live, but also can be as far away as 3 hours. Houston is a very large city, and so the proper area of Houston itself can sometimes take just 45 minutes to get from one part of the city to the other part of the city. And so what we try to do is work with our patients with their appointment times. We also receive many patients that come to our center from Mexico due to that proximity that we have. These patients travel to Houston for their care, and we also cover a large geographical area out to the west part of Texas. For example, in El Paso, Texas, we have an outreach clinic that we do out there 2 times a year. We've actually had this clinic out in El Paso for the last 25 years, and we service the patients out there by taking a team that travels out there with our physicians twice a year, and we usually see 25 to 30 patients during a 1.5-day visit time period. El Paso is about 11 hours from Houston, and yet these patients are very committed to come in for their clinic visits when we go out there as a team. And so it's very nice to be able to see how even as far out there as in El Paso doing an outreach clinic that our patients are able to be seen by our healthcare team. And so I think when we think about the area that our treatment center covers, we do include that El Paso area in addition to Houston and the surrounding area. We also offer support to our patients, work with local resources to try and make sure that they have, for example, gas money or transportation costs covered through other resources to ensure that they can get here to their clinic visits. The hemophilia community benefits from a network of hemophilia treatment centers that are divided by regions through the federal government, and each region has a regional coordinating center that's responsible for working with individual treatment centers to actually support the management of the Maternal and Child Health Bureau grants and the Centers for Disease Control grants, along with overseeing other programmatic activities. So our center here in Houston is the regional coordinating center for the Great Plains region, and we work with 17 other treatment centers in the states of Texas, Louisiana, Oklahoma, Arkansas, Nebraska, Iowa, Kansas, and Missouri. And we offer communication to ensure that we are able to deliver information to the staff members at these HTCs so that they can have the resources to provide quality care to their patients, ensure that we can participate in yearly meetings for this staff in these different states so that we can help promote the efforts of what we are working with our grant. There are various objectives that we need to meet, and I think most importantly, we also report information back to the federal government about what it is that the hemophilia treatment centers are doing within the community with the patients. As a hemophilia treatment center, we are eligible to access discounted pricing through the Public Health Service Veterans Healthcare Act of 1992. For example, our 340B pharmacy program in our center was established in 1995, and since that time, we've been able to operate this in-house pharmacy that supports and enhances multiple services for our patients and our center. Some of the many services that we're able to enhance are educational programs for our patients, such as infusion classes or parenting classes, summer camps, and various community events as well. What we've been able to do also through the years is work closely with other hemophilia treatment centers in our region to help them develop their own in-house 340B pharmacy program so that they can also utilize these resources, this program income, to provide enhanced services to their own patient community in their area. Similar to many other hemophilia treatment centers, we work in collaboration with our local hemophilia chapter, the Lone Star chapter of the National Hemophilia Foundation, and many of these local activities are activities that our staff are frequent contributors to. Some of them include the Camp Alapoma Summer Camp, the annual Bleeding Disorders Conference, where multiple ongoing educational topics are presented, Blood Brotherhood programming, the annual Women's Retreat, a Parents Empowering Parents program, in addition to trying to advocate for the community needs, be it here at a state level or possibly on a national level as well with other organizations. Here at our treatment center, many staff members have also served or currently serve on many boards, including the National Hemophilia Foundation and the World Federation of Hemophilia Working Groups, for example, the Physical Therapy Group, the Nursing Working Group, and the Social Work Working Group, in addition to the Cultural Diversity Working Group as well. Currently, some staff are contributing to the Comprehensive Care Sustainability Collaborative through the National Hemophilia Foundation. They serve as the Hemophilia Alliance Board Chair, the Alliance Pharmacy Board Vice Chair, and we actively participate as an international hemophilia training program through the World Federation of Hemophilia. As a matter of fact, we are one of the 5 hemophilia treatment centers designated with this title in the U.S., and we train approximately 2 healthcare professionals from other countries within a given year so that they may go back to their own HTC or program in their country and continue to grow services and resources for that patient population within their own country. Every spring, our hemophilia treatment center sends a letter out to our patients about hurricane preparedness, and we provide contact numbers outside of hemophilia treatment centers, different organizations, and other helpful hints for them to be prepared in case there is a hurricane. And so, as usual, we provided that in the month of May, and the night of August 25th really tested what plans we had in place because Hurricane Harvey did target the Houston area for a few days, and it left a devastating impact behind, not just for some of our staff, but for many of our patients. I remember talking to our medical director, Dr. Miguel Escobar, on the morning of August 27th when the massive flooding started, and we were discussing how we would take care of patients during this time, and we were also trying to address our own issues. One of the great things that happened throughout that morning and throughout that afternoon is that I continued to get texts and calls from our local chapter executive director, who was also being impacted by Hurricane Harvey, the Hemophilia Alliance president and CEO, and multiple staff members from NHF. And everyone was reaching out to find out how we were doing and what they could do to assist us to help our HTC and our patients. And at that time, I don't think any of us realized how much of an impact the storm and the aftermath of the hurricane was going to have on us. Over the next few days, we continued with multiple calls and emails that came to our physicians and myself from across the country offering support. This really was a great example of our hemophilia network and the community across the country that was willing to assist with whatever was needed or whatever could be needed in the near future. We came to find after a few days that there was very few patients that were in need of factor or immediate supply needs because several of our patients are taught to be prepared for an emergency, but there were patients that lost their factor, lost their homes, and what we started doing over the weeks following Hurricane Harvey was working closely with them to give them resources in the local area, but also from the hemophilia community that were set up to assist them. And it's going to be a long road to recovery, but I think the immediate need and impact that the patients had, and I know our staff had here at the center, was knowing that the hemophilia community, it's a small community, but they stood ready to assist in some of these devastating times. And then we quickly changed our focus to see how we could offer support to those impacted by Hurricane Irma and Hurricane Maria in Florida and Puerto Rico. So again, I think this experience that we've had, one, was nice to know that we have a system in place that is able to assist individuals as we confront some of these disasters, and again, to me, prove that this hemophilia community really is a network of resources and support when it's needed and called upon.